Well, good afternoon, and thank you for joining us. We're here today to provide you with an update on the Ontario COVID vaccine rollout. And I'll be honest, the shipment delays with the Pfizer vaccine have been incredibly disappointing. And to be told on Friday that we would receive 18,200 less doses of the Moderna vaccine, I can't stress how frustrating that is. But we continue to press ahead and make steady progress. Our plan to accelerate the vaccination of Ontario's most vulnerable population is underway. We are actively giving out first doses to residents in long-term care, high-risk retirement homes, and First Nations elder care homes, with an updated goal for completion of February 10th. We're expecting to receive 63,400 Moderna doses from the federal government by February 5th, and these will be administered to our most vulnerable as soon as possible. To date, the first round of vaccinations has been completed. For those who are willing and eligible, in all long-term care homes in many regions, including Toronto, Peel, York, Windsor-Essex, Durham, Halton, Hamilton, Niagara, Ottawa, and Simcoe, Muskoka. As of February 1st, we administered over 344,000 doses of the vaccines, with over 70,000 fully vaccinated. And beginning this week, vaccination teams will be distributing vaccines in First Nations flying communities in the north as part of Operation Remote Immunity. With the uncertainty surrounding a steady supply of vaccines, it's clear we need to start production of COVID vaccines right here in Canada. We need to ensure that our ability to protect our citizens is not compromised by a lack of vaccine supply. We need a reliable source of vaccines in this country as soon as possible, and I will continue pushing for that. In the meantime, we continue to build our capacity so when we receive enough supply for mass vaccinations, we will be ready. We currently have the capacity to vaccinate 40,000 people per day, and we'll be able to triple or quadruple that pending the federal government supply. Getting vaccinated is our path to normal. So when it's your turn, please go get the vaccine. Until then, I couldn't be any clearer. Please stay home, stay safe, and save lives. Thank you, and God bless the people of Ontario. Now I'll pass it over to General Hillier.
Premier, thank you, and ladies and gentlemen, good afternoon. We were told this Friday that we weren't getting any, or we have a reduction in Moderna, and last week we didn't get any Pfizer. This week we're expecting today, tomorrow to receive about 26,000 doses, the same next week. And so we are in a bit of a drought, there is no question. Yesterday I was out to Guelph and visited the public health unit Guelph and looked at their mass vaccination site, which was empty. I went to Sunnybrook Hospital and their mass vaccination site and looked at it, which was empty. And they have the capacity of several thousand each per day and the possibility to ramp up past that. So all of us are a little disappointed, a little frustrated, and chomping at the bit to do more and get the vaccines to us. We're waiting for our next delivery of Moderna, which will come in on the 5th, the 6th, or the 7th along that time frame, and it will immediately go into the arms of people, the residents in those long-term care homes around the rest of Ontario that we have not yet been able to vaccinate. We haven't wasted our time while we have been waiting for those vaccines to arrive, however. We've been concentrating on ensuring that people who have had one needle, Pfizer or Moderna, will be guaranteed the second. And yes, we have mitigated the challenge in vaccine supply by delaying the interval on the Pfizer to 35 days as a normal thing while supply is still tight, and going out to 42 days if absolutely essential. We hope to not have to go to 42 days. We want also not only to guarantee the second needles in arms, but to complete as quickly as possible, even in this reduced supply, vaccinating the residents in those long-term care homes, the high-risk retirement homes, and the elder long-term care homes that we have not yet gotten to around the rest of the province of Ontario, as I said. And at the same time, we continue with what we are calling Operation Remote Immunity, and the Premier mentioned it. We started some 3 weeks ago with vaccines into the arms of residents and elder long-term care facilities in 3 communities along James Bay. And yesterday, 6 teams under the capable leadership of Dr. Homer Tien, supported by Horing, supported by medical professionals out of Queen's University, compliments of the Dean of Medicine there, supported by a company called Callian, who've had contracted nurses and people who are going to help vaccinate people in those isolated communities, all part of one team, all of whom have received their vaccinations, and all of whom are now, as of yesterday, heading into those communities, those 6 teams to vaccinate. One of the teams arrived late yesterday afternoon, tired after a long day of travel that was interrupted by weather, and yet the community was waiting for them. They wanted the vaccine, so they started vaccinating, and indeed vaccinated through to almost midnight last night. All of the teams have been doing that since they left yesterday morning, and now we have more than 2,000 vaccinations in the arms of residents, elderly and residents and caregivers in those isolated communities that they have started. And they will continue to roll this program out. We've done more than that also. We've carried on with our planning. We've worked with each of the 34 public health units across the province of Ontario and the medical officers of health who run them, who have responsibility for delivering health care. They will run out the vaccination program to the last part of phase 1 and into phase 2 when we expect more and more doses of vaccines. We gave them our plan, asked for theirs in return. We've received them, we've gone through them with them, and now we're going through tabletop drills with most of the public health units to work their plan, to see where we can assist them, to see where we can remove obstacles from their path, and in some cases, to see where we can simply get out of the way and let them carry on with that plan. And while we're doing that, as they finalize their plans, we're driving hard to make sure we have the IT framework in place to support registering online, to support getting a vaccination appointment, and to support getting your data in there so that when you show up at the clinic, it is as an efficient process as possible. And then you also, by the way, book your second appointment for your second needle to complete the immunization program. And we're also working to lay out the communications education for the public so they understand the vaccinations. All this is happening now, so we want to be ready in case more vaccines show up unexpectedly. The public health units are working through 3 main lines heading forward in phase 2. Number 1 is the age bracket group. And we're not there yet simply because we don't have the vaccines. But that priority will start with 80-plus-year-olds, 75-plus-year-olds, 70-year-olds, and we'll move down each bracket as the numbers start to diminish showing up for vaccinations because we will have gotten through most of that group. Secondly, and concurrently, we'll roll out special vaccination clinics, mobile vaccination clinics, if you will, community vaccination clinics, roaming vaccination clinics. Each of the public health units calls them something differently at times, and they will go into our communities at risk and get at some of those populations who will not go online to get their information. Multi-generational family, of course, living in one dwelling at times, and the kind of people that sometimes are reluctant to come to mass vaccination sites. And we want to be able to go right into their communities and be able to let them know what is available to protect them from COVID-19 and to offer them vaccinations in a fair and effective manner right where they live as much as possible. And then thirdly, the essential workers would be a part of phase 2, and we would look at being able to vaccinate. And our priority table now is working through essential workers and deciding how, in the combination of educators and police and firefighters and farm workers and meat plant workers who guarantee our food supply, how we would work that priority. The public health units are looking at 3 main streams of vehicles to deliver those. Number 1 are the mass vaccination sites. We saw an example in each of the hospitals up till now. We saw an example at the Metro Toronto Convention Centre when Toronto Public Health, for a short period of time, ran a mass vaccination site. We will replicate those around the province to 50 or 75 or even more to give us an immense capacity. And that may be where essential workers will go because it would be easy to delineate. For example, it might be an easy way to say, close a school district for a day, take all the educators, go to that mass vaccination site, receive your vaccine, and 21 or 28 days later, come back and do it all over again. And that minor disruption, and it's not minor, but that disruption would be minor to all the school that we've lost so far because of this pandemic. Secondly, to get at the age bracket and be able to offer them those vaccines, particularly those who are mobile, we would look at family physicians, perhaps coalesced in one group to do all of their patients and offering them the vaccine, but also the pharmacies throughout Ontario. The Premier said it this morning during a meeting with the Chamber of Commerce of how crucial the pharmacies will be to our rollout. All 4,600 pharmacies in Ontario won't be vaccination sites. A lot of them will, however, and maybe those will be more robustly staffed by the pharmacy chains. But through there, we could easily delineate that on certain weeks in April, May, we would have age groups 80 and up, 75 and up, and 70 to 75, and so on down the age line. And it would be easy to make an appointment at a pharmacy and go get your vaccine there. And I've already talked about mobile vaccination sites or community-based vaccination sites or on-site vaccination clinics that would run to look at those communities that are at risk. That's going to start late March, early April, depending on the arrival of vaccines in bigger numbers. Between now and then, we're going to concentrate on those second needles. Make sure we get them into the arms of the people who have had their first needle. We're going to finish off vaccinating and offer the opportunity for a vaccination to the residents in the long-term care homes, high-risk retirement homes, and elder care facilities. And then we're going to go back to those homes once more vaccines arrive and offer that same opportunity to the essential caregivers and the healthcare workers and the staff who work in the homes that we simply don't have enough vaccines to help vaccinate right now. And then we want to reach out to the retirement homes across Ontario. There are more than 700 of them. About 200 have already had vaccination clinics at the home. And so we want to work through the rest of them, offering that level of protection. And then most importantly, we also want to work with the First Nations and the Indigenous people of Ontario and work through the First Nations reserves around Ontario based on a priority matrix that their leadership has been helping develop. We want to do all of those things from the 15th of February when we will start to see more vaccines arriving through to the end of March. And then also at the same time, pick up those remaining healthcare workers that we have not yet gotten to with the vaccines and be ready to roll into phase 2, as I said earlier. We can't lay out a specific date and time for when an age bracket will be available or have vaccines available. What we're telling you is the sequencing of how we will do it. And when the vaccines arrive, we can be more precise and more specific and talk about where you should actually go. And that's what our comms strategy will run out and lay out and publicly articulate over this next week's here. Ladies and gentlemen, I'll stop there. Thank you.
We'll go over to the phones for questions.
First question from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi there. Thanks so much for taking my questions. I wanted to start, Premier, by asking you, you mentioned in your opening remarks about the need to ramp up domestic production.
Yes.
Of course, we heard from the Prime Minister today that Ottawa plans to do that, but it sounds like that won't be live until the end of this year. So, I mean, what do you make of the fact that this doesn't seem to be at least a very short-term solution? And do you have faith in the federal government's promises to vaccinate all Canadians by September and for 3 million Canadians to be vaccinated, at least receive a dose by the end of March? What do you make of that in light of the supply issues that we're experiencing?
Sure. Well, first of all, great question, Laura. And I've been saying right from the get-go, I wish we'd be able to, produce the vaccines here. We have the know-how, we have the knowledge, we have enough pharmaceutical companies, especially here in Ontario. And if there's one thing that I would have wished, we would have done this a long time ago with the support of the federal government. In saying that, I'm glad that we're starting to do this, and hopefully we'll never face another pandemic like this, but it's always good to have backup and a company that is able to produce the vaccines. And as for confidence about getting everyone vaccinated, I can't speak for the federal government or the rest of the provinces. I have total confidence in General Hillier and the task force table and both ministers that if we get the vaccines that we need, we will get everyone vaccinated who wants to be vaccinated by appropriate time. And I'd leave that up to General Hillier, but it's all based on getting the vaccines. And hopefully, as the General said, if we had all the vaccines in the world that we needed, we could probably get it done sometime in July. But again, the uncertainty is a real problem. If you look at it, since we've rolled out these vaccines, General Hillier and his team has had to change their plans 3 times, and that's tough, especially the size and the population of Ontario.
Follow up?
Thanks, Premier. I wanted to seek some clarity from you about a story we wrote in the Globe and Mail today about Brooke Fallis, who led the ICU at William Osler, and he's claiming that that you placed a call to the CEO of William Osler, complaining or criticizing his comments regarding Ontario's pandemic response, that you somehow interfered in this. Can you speak to whether you have ever spoken to Dr. Mohammed about this doctor or
No.
any other doctor for that instance?
No.
And if you can respond to some concerns out there in the medical community that you or your government are trying to clamp down on dissent or criticism of the pandemic.
That's 100% totally false. And I think Dr. Mohammed at William Osler has addressed this. We don't get involved in any HR issues at all in any hospitals. I would never direct the CEO to promote or fire someone. It just never happened. So I guess they'll deal with it, and I'll leave it at that, because I just don't do that. It just doesn't happen. I welcome ideas, and there's some docs that disagree with the docs that we have. I welcome that. Reach out to them. I welcome when the media tells us there's issues, and I've said that from day one. Even Lisa at CBC, for instance, because of Lisa's comments, we're getting air conditioning in long-term care. So I welcome the ideas. Doesn't bother me someone disagrees or agrees or whatever. We have a job to do, and we're going to do it.
Next question.
From Lorenda Redicott at CBC News. Please go ahead.
Hi there, Premier. Those delays that we're seeing now for the long-term care homes, did your government make a mistake in terms of its priorities early on? And maybe this is also for the general.
A mistake in what? Vaccinating?
Yeah, vaccinating.
Well, to the contrary, Loretta, actually, I remember some people were criticizing us because, we had one in the hand instead of two in the bush, per se. And the general and the team decided it's better to hold on to some of these vaccinations, and it's proof in the pudding. You look at our friends over in Quebec and doing a great job, but they have 0 second vaccinations, 0. We have 70,000 already done because of the smart move that General Hillier and the task force and the ministers and everyone made the choice to be cautious. We were nervous about getting all the vaccines. And we were proved to be right. Well, not me, the team. So that was a great choice on General Hillier's behalf. I'll pass it over to you, General.
Thank you for the question. When we first got the Pfizer, we realized we couldn't move it into the long-term care homes and then vaccinate the residents directly. So we took the next best approach, which the medical professionals assured us would give us a huge percentage of protection for those residents. That is to say, get the essential caregivers and the healthcare workers and the staff who work in the residence and by whom the virus travels into the residents, the long-term care homes, to get them to come to the vaccination center where the Pfizer had been delivered and vaccinate them. And we did that to the tune of tens of thousands of those staff for the long-term care homes and the higher risk retirement homes and retirement homes. And that was the first level of protection. And we started that. In fact, the first vaccination in Canada was into the arm of an essential caregiver from one of those long-term care homes here in Toronto. And I think many of you saw that on TV. As soon as we got Moderna, we started moving it directly to the long-term care homes and high-risk retirement homes. In Toronto, the first day we received Moderna, 2 hours later, we had Moderna being injected into the arms of residents in a home right here in Toronto. And we continue with that. Shortly after that, we got the protocols after working with Pfizer and the federal government to move Pfizer, and we started moving it to long-term care homes right away, taking the Premier on his challenge. So we did what was right based on the characteristics of the Pfizer, giving protection to the residents initially by vaccinating their caregivers to prevent the travel of the virus into the home through them. And then as soon as we could with Moderna and with Pfizer, when we could move it, vaccinating the residents itself. And we made huge progress in that. We all want to be faster. We all want to get it done. I assure you, people are consumed by this mission and want to get it done. And then we run into this drought of vaccines. We're using every single one that we have to the best precision possible, if that's the way to put it. And we hope to be able to finish vaccinating the residents in any other homes, as the Premier said, by 10 February. we would have been finished by Friday if we had had enough vaccines. So we're confident that we had the best rollout possible, given the characteristics of Pfizer, the delivery of Moderna, and the challenges that we encountered there. Thank you.
Follow up?
And given that vaccine drought now, I'm thinking about the vaccines given to non-frontline hospital workers. We heard in the technical briefing it's unknown how many vaccines across the province that could add up to. Whose responsibility should that be? Is any of it on your government? And what do you think the consequences need to be here?
Well, before I pass it back to General Hillier, I think we've explained this more than once, probably a dozen times, that when there were seats open and people didn't show up for the appointment, we had two choices: either toss the vaccines in the garbage or find a healthcare worker to take the seat. So I'll pass it over to you, General.
And Premier, thank you. And really, just to confirm exactly that, we have a prioritization built by Dr. Rick Hillier and his sub-table inside of the healthcare workers. That is a guiding parameter and framework, not a constraining one. If we stayed to it completely rigidly, we would have great difficulty getting needles in any more than a few arms per day. And we believe that speed trumps perfection. And my counsel to the people running the mass vaccination centers at that time, the CEOs of the hospital, was, look, we have this priority framework. It is a wonderful guiding document. Healthcare workers are in it, and go out and do it. Do not be constrained to the point where we, as the Premier said, we have empty seats and waste vaccines or miss opportunity to put a vaccine into somebody's arms. And that's exactly what they were doing. And were there changes where somebody higher up in that priority matrix should have gotten their vaccine and somebody lower down did? Yes. And we would catch them up in a week or 2 weeks or 3 weeks after that. And that's what's been happening throughout. You will not get perfection. And if you strive for it, if you strive for perfection in that matrix, you will slow down the vaccination process overall. We did not want to do that because we wanted to bring the greater level of protection while still adhering to the healthcare workers as our number two priority, excuse me.
Next question.
From Colin DeMello at CTV News, please go ahead.
Hello, good afternoon, everyone. Premier, my first question is for you. So Ontario got the first shipments of the COVID-19 vaccine on December 14th. Between that day and today, there have been 1,154 seniors who have died in long-term care homes. I'm wondering from you, Premier, could the government have saved lives by vaccinating long-term care homes first over healthcare workers?
Well, again, that was our goal. If you remember, Colin, Pfizer gave us instructions that we couldn't move the vaccine. So our hands were tied. We were trying to get the long-term care frontline workers, the PSWs, and we did get quite a few of them through the local hospitals, and UHN started. They did a great job. But if we had the flexibility at the time, we would have moved right in there immediately. And when we found out we had the flexibility with the Pfizer and with Moderna, we made a move immediately. And it's tragic with long-term care right across the board. It's terrible. It's terrible what happened up in Barrie long-term care, because the UK virus got in there and just went through there. And we're doing something at the airport to make sure that doesn't happen again.
Follow up?
Thank you, Premier. But what I don't understand is other jurisdictions, whether it's Quebec, they decided to take the Pfizer vaccine directly to the long-term care homes. We learned from the COVID-19 Science Advisory Table that in Israel, as an example, they repackaged the Pfizer vaccine in standalone freezer units and sent them to the most vulnerable people who needed them the most. Why back in December 14th did Ontario not do everything in its power to try to move the Pfizer vaccine? And I guess the central question for the general as well, did we ever ask Pfizer whether we could actually move the vaccine, or did we just take Pfizer at its word that they were not to be moved?
I'll pass it over to General Hillier.
No, we took the advice of our medical professionals and our pharmacists, who were in constant discussion with the Health Canada, the NACI for immunization guidelines, and Pfizer itself. And we did not have permission to move the vaccine until, in fact, we started doing the protocols in early January to give us the protocols to be able to actually move it. And so, no, we didn't make a decision just to go by what Pfizer said. and not ask any question. There was constant communication back and forth, constantly increasing the knowledge of the vaccine itself. I know what Israel did. We talked to the Minister of Health from Israel last Tuesday. We were inspired by the fact that the vast majority of what they are doing, we are also doing. We have also encountered, we have also planned to do if we have not done it yet. We took the advice of our medical professionals, working with Health Canada, NACI, and Pfizer to make the decision to move Pfizer when the company said it was right to do and the protocols were in place.
We'll take one more reporter from the phone before we move to the floor.
Question from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Please go ahead, Brian. Open your line.
Sorry about that. I'd like to hear from both the General and the Premier, if I could, on this. The federal government has been posting the expected deliveries from both Pfizer and Moderna on their website for some time. Obviously, when Pfizer started being reduced, they removed Pfizer. Today, they removed the Moderna doses expected for the week of February 22nd through 28th. And I'm wondering, given the reductions, the no vaccines delivered last week that we've seen, how concerned are you that this suddenly was removed from the federal government's website? Have you heard anything directly from the Fed that that shipment may not happen?
Well, it's very, very concerning. And when, you know, you're dealing with a province the size of Ontario and the population the size of Ontario, when General Hillier and his team has the job logistically to get these out, and all of a sudden it changes once, and then it changes again, and then it changes again, it makes it very difficult for General Hillier to do the job. But in saying that, he moves forward. You know, like a real soldier he is. He doesn't stop. It doesn't matter how many changes. He just keeps going and going and going. I'll pass it over to you, General.
So Brian, thank you for the question. And I heard about it just before I came over here to come on to the press conference here, and my heart went pitter-patter, quite frankly. I don't know if it's just a number that's disappeared, if it's a computer glitch or an IT glitch, or if there's something else behind it. I'll tell you what has happened, though. With the Pfizer interruptions in supply, we've lost confidence in the supply chain. And that means, despite what the Premier said earlier, we were leaning forward and using some of the second doses to get to some of those residents in long-term care homes without making sure we had one for each person we had given a needle to already in our inventory. And so we got caught a little tiny bit. We won't be caught again for the immediate future until we rebuild that confidence in the Pfizer supply line. With Moderna, the deliveries are 3 weeks and more apart. We know when they're scheduled. So because of that time frame, we have to keep the second dose in sight. And that, of course, both of those things now slow our delivery program until we have that confidence rebuilt, particularly when we went down for this coming days here, some 20 to 25% in the number of Moderna vaccines we were supposed to receive. Look, I don't know if something more severe than an IT glitch caused that number to disappear. I don't know if somebody was updating it to make it actually more, which we'd love to see. I'm simply crossing my fingers, hoping that we are not going to see a further reduction in Moderna. And I know that the team is communicating to Ottawa now and talking to Ottawa to determine exactly why that number disappeared, and if it's just a number disappearing or if there's something more serious behind it. So I can't answer exactly what it might mean, Brian. We are going to watch our second dose of Moderna for those we are giving needles to right now and over this next week to make sure we have it when they come due.
Follow up?
The announcement by the Prime Minister today about the plant in Montreal that will be ready sometime in July or August, and then, according to Minister Champagne, will produce vaccines by the end of this year. I'm wondering, Premier, I know you've spoken to leaders in the pharmaceutical industry here. Mm-hmm. Do you get the sense that some of the simpler vaccines like the AstraZeneca, Johnson & Johnson, or Novavax could be produced in Ontario or elsewhere in Canada with a bit of dedication in planning? Because this seems to be a plan that focuses on one plant that is still under construction and won't be ready for another 12 months.
Yeah, well, first of all, I think it's a good decision that they're moving forward. I always get criticized. I always say armchair quarterbacks to people and so on. I don't want to play the armchair quarterback with the Fed's decision. If you would have come to Ontario, we have a building, we have endless buildings. It was ready. I'd love to plug into some of the other pharmaceutical companies. I will be speaking to one of the large ones this afternoon, and it'd be a lot easier. Just come over, set up the line, and hopefully we'd be able to get them in a month or two, rather than build a new building. And hopefully we'll have everyone vaccinated by that time. But a good question, Brian. I just don't feel comfortable criticizing the process of any other level of government. Everyone's working well together, working collaboratively. So at least it's a move in the right direction.
Premier Jamie, initial reports right now, but it looks like 2 officers have been injured in an altercation, almost a routine altercation in Etobicoke. First of all, do you know any more, and your reaction?
Well, first of all, I think the world of our men and women that serve day in and day out. And it's literally, I just found out while I was walking down the hallway here, it's down the street from our family home that thousands of people have been to. So, it's concerning. And I just want to wish the 2 police officers that are at Sunnybrook all the very best, a speedy recovery. I'll be giving you both a personal phone call when you're up and at it again. But we have to protect our police at all costs. They put their lives on the line every single day. And imagine, and there's a lot of jobs like that, but imagine leaving your house every day, kissing your kids goodbye and your spouse goodbye, and not knowing if you're going to come back. I love our police. Simple as that. And I think I'm going to pass this to the Solicitor General. As we say, she's the top cop. So, and I know she loves our police.
Thank you. No further details other than the fact that, of course, the 2 injuries to our Toronto police officers. And just echoing what the Premier said, we've invested a lot of time and a lot of power into making sure that our police have the resources they need to protect our communities, to keep our streets safe. So I just thoughts and prayers to the officers, and we'll share more details as we can make them public. Thank you.
And is that it? So, okay. So I just want to give a shout out. I want to give a shout out to a few folks in the media. And I'm not going to mention the outlet or the people, but they ended up getting laid off, a lot of people today. And that's heartbreaking. I just want to tell you, keep your chin up. You're going to come back. You're going to get back on your feet. And something, maybe you'll find a career within the media, or you might find it outside the media. But I know, when you go through tough times, you sit back and think the world's coming to an end. Please stay positive, and you will come back, and you'll come back stronger than ever. And there'll be lots of opportunities for you out there. And I appreciate, to the media, I appreciate the tough questions, the other questions. You're our eyes and ears out there. There's only so much we can cover in a big province, and we rely on you. So I do appreciate the job that you do. And for the men and women that got laid off today, stay positive. Things will get better. So thank you, and God bless. Thank you, everyone.
Thanks, everyone.